In 1809, during winter, a terrifying mystery gripped the Kentucky frontier. A healthy mother of 5 named Jane Todd Crawford was slowly being consumed by something growing inside her body. At first, neighbors whispered that she must be pregnant. But the swelling kept growing and growing until her abdomen became so enormous that many believed she was carrying a curse, a deadly disease, or perhaps something no one could explain. Jane knew one thing for certain. It was not a child. The pain was unbearable. Every movement felt heavier. Every day brought new suffering. And in an era when medicine could do little more than guess, her condition seemed like a death sentence. No one knew exactly what was inside her. No scans, no x-rays, no tests, only fear. Then rumors reached her about a physician in Danville named Dr. Ephraim McDowell. Some called him brilliant, others called him reckless. What he was proposing sounded almost insane. Jane mounted a horse and began a dangerous 60-mile journey through the frozen Kentucky wilderness. She was riding toward a procedure that many doctors considered impossible. When she got there, McDowell examined her. He made a startling conclusion. The mysterious mass was not a pregnancy, it was likely a giant ovarian tumor. Today, that diagnosis might sound routine. In 1809, it was terrifying, because treating it meant attempting something few surgeons on Earth had ever dared: opening the human abdomen. At the time, such operations were widely believed to be suicide. There was no anesthesia, no antibiotics, no sterile operating rooms. Most patients died from shock, infection, or blood loss. Many physicians refused to even try, yet McDowell believed there was one small chance. Without surgery, Jane would almost certainly die. With surgery, she might die anyway. Christmas Day was chosen, December 25th, 1809. As winter winds swept across Kentucky, Jane climbed onto a wooden table and prepared to face a nightmare unlike anything modern patients can imagine. She would remain awake for the entire operation. No painkillers, no anesthetic, nothing. Only faith. As the surgeon's knife cut into her abdomen, witnesses later reported that Jane prayed and sang hymns to endure the agony. Minute after minute passed. The room remained silent except for the sounds of surgery. Then came the shocking discovery. The mysterious growth weighed more than 20 pounds. A massive ovarian tumor had been hiding inside her all along. When the operation finally ended, nobody knew whether Jane would survive the night. History suggested she wouldn't. But then, she lived. Days passed, no deadly infection, no fatal complications. Weeks later, she returned home. And the greatest surprise was still to come. Jane Todd Crawford would live for more than 30 additional years. The woman everyone expected to die became one of medicine's greatest success stories. Her survival solved the mystery that had terrified an entire community. More importantly, it proved that abdominal surgery could succeed. What began as a desperate gamble on a Kentucky frontier helped change the future of medicine forever. But perhaps the real mystery isn't what was growing inside Jane Crawford. Perhaps it's how a woman in 1809 found the courage to climb onto a wooden table, fully awake, and trust her life to an operation that the world believed was impossible. And because she did, history remembers her not merely as a patient, but as the woman whose courage opened the door to modern surgery.